basically looking at understanding the techniques through which we can effectively communicate as a healthcare practitioner is what we basically discussed yesterday. And if some of you recall, the discussions were centered around understanding, the various methods through which you can use and, speak to the patient. So things like sign language, braille. We looked at posters, information, which can be relayed through, say, for example, sometimes patients and sometimes family members of the patient. You have to give them information which could be given out as leaflets in order to make them understand the procedure or the process that they will go through if they are undergoing a treatment. The care plan sometimes has to be explained. And there were different ways through which we could do this so that the plan which is being put in place to provide care is effective and is meeting the requirements of the individual. We looked at some of the barriers. We also looked at understanding how these barriers can be overcome. How do we look at the process of confidentiality when we look at some of the legislations and regulation which are key and mandatory, like the Health and Social Care Act of 2014, Data Protection Act. We looked at the Commonality Law Act. And these are bits that we have to be aware of as practitioners, people who are working within this sector, to ensure that, when we give information, when we look at seeking information, this information is given in, is basically user-driven and it's access-driven, so that the privacy, individuality, and dignity of the individual is maintained. Now, in the third learning outcome, we are moving away from communication and we're going to be looking at discussing infection and spread of infection. Now, this is at a unit which is more or less related to, nursing. Some part of this learning outcome is directly an outcome of, probably a unit coming from nursing and midwifery. And this unit primarily is called Infectious Diseases. Now, in the learning outcome 3, we are looking at focusing on understanding what is infection. How does it spread? Why is it important to control the spread of infection? And then there are 2 assessment criteria which we will look at in merit and distinction, which talk about, how if there's an outbreak of infection which happens, how do we look at controlling it, managing it within a health and social care setting? So we'll take up a scenario of a health and social care scenario, which will be a care home. An old age care home is what we will take an example of. And the distinction criteria talks about how risk assessment can be done primarily to avoid the spread of infection in a particular healthcare setting. So again, we'll extend that scenario of, care home into discussing the distinction criteria as well. Now, some part of this learning outcome will take you back to studying biology. I don't know how many of you have studied life sciences or biology during your school days, but we'll be looking at revisiting some of the key definitions of what is a fungi, what is a bacteria, what are parasites, what are protozoa. And, I think when I was looking at preparing the lecture, it took me back the memory lane in terms of when I had actually studied biology in my, year 10 and during my GCSEs. And, especially for those of us who went into medicine and took up physics, chemistry, biology, and maths, going towards medicine, would be able to recall when we discuss some part of this, today in today's learning outcome 3. So there are a couple of things in terms of handouts which I've got, which I will provide so that you are able to, for those of you who are interested in getting a bit more detail, you would be able to, essentially look at getting the details through these handouts. And these handouts would predominantly be useful for you to, get a bit more knowledge than just what I have put together on the slides today. So obviously, I've looked at putting together these slides, which are predominantly related to, looking at the command verbs, and most of the command verbs in today's, learning outcome are predominantly explained. So if I just quickly bring your attention back to the unit specification, as you can see, it talks about explain, and then there is analyze and assess, which is the merit and distinction criteria task. So basically, most of it is know-how. That means you need to know and have the knowledge about how, some of these, some of the key terminology and terms. And it is to do with the fact that when you talk about, know, that means knowing, that means you have to basically know about the key facts, the key concepts which are required to be studied in this particular learning outcome. So what we'll do is we'll start off with some key terminology. with regards to, kicking off our discussion. There are a few bits that I've tried to cover pretty much everything in terms of the unit content that you see on the slide in the presentation. And some of these slides we'll skip because you would be, going through some of these slides on your own, because I've expanded them, essentially to ensure that, for example, to ensure that you have all the content that we have to study in this is actually available. And because this learning outcome is going to study infection and infection control in isolation, when we move to LO4 next week, it'll have no bearing on what has been studied in learning outcome 3. So the idea is to make this presentation and our discussion a bit more holistic, and it should give you all the information that you need to be able to cover this comprehensively. Now, one or two things which I will start off with, in terms of what is infection and, what are infections. This is what we need to be able to, get hold of, so that we are able to understand that, when we look at spread of infections and when we look at predominantly talking about, infections, what is it that infection actually means? What is the definition of this word infection? And how do we look at ensuring that we have a good understanding of what is infection, what is infectious diseases, how it spreads, and how do we control the spread of infection when we talk about pandemics or endemics. Now, let's look at very briefly, what is infection? Anybody, any thought process? What is infection? What is the meaning of the word infection? So infection, if I say, is a process of, primarily, if you are healthy and fit and you get infected by a bacterial, infection, because this word I love to use. So if you get infected by, say, and you start showing certain symptoms and your body becomes affected, like you, for example, cough, you sneeze, then it will be interpreted that you've caught some sort of an infection. That means either a virus or a bacterium, or some sort of a, say, fungi or an allergy, which has caused your body to react, and that would be termed as infection. The symptoms that you show, which are primarily how your body is reacting, is what will be termed as, infection. And the sneezing, coughing, maybe running a bit of fever or a running nose, or maybe, you have body cramps and things like that. It could be any form of symptoms that you show, and they would be termed as, infections. And the outcome of that will be termed as, depending on when it is diagnosed by your GP and your doctor, that would be termed as an infectious disease. And they, when I say they, the practitioners, healthcare worker, the clinical nurse, the doctor, they will then be giving you suitable medication to be able to get rid of that infection. Now, when we talk about diseases, before we get into infectious diseases, what is a disease? We look at a literal definition of disease. A literal definition of disease would be, it is some sort of a disorder. That means your body functions in a particular way, but if you stop functioning in that particular way and it feels a bit unusual, then you're showing a bit of a disorder or a diversion from the structure in terms of how your body normally functions. And when you have this as a cause, that means there is diversion, or you're going away from some sort of let's say usual functioning of your body, then in this case this will be termed as that you have a disease, or there is a disorder which is come over, and that disorder would essentially not allow you or your body to function normally, and that would be termed as disease. Now, when we look at a simple definition of disease, it would be called an illness or some sort of a sickness, and that would basically make your body not function in a normal way, and they will be characterized. When I say they, I mean disease will be characterized by some sort of symptoms, and these symptoms could be any sort of a symptom under the sun. So I could think of when I have allergy, when there is increased pollen in the air, you have a dripping nose, and that is a symptom that you have got infected, or you've caught a disease. When you have fever and it is running for a couple of days and it doesn't go down, that means you have a flu. So there are lots. You could cough, you could sneeze, you could run a fever, you could show rashes on your body, you could have cramps, you could have a headache, a severe headache, you could sweat. it could be any sort of symptoms that you show, and that would say that you've got an illness, or you've got a sickness now, and that will be termed as disease. Now, if we combine these two together, what is infection and what is disease, then we look at infectious diseases. So infectious diseases are disorders caused by organisms, and these are microorganisms, which are organisms like bacteria, virus, fungi, or parasites. So sometimes when I give you a simple example, if all of us have pets, either a dog or a cat, so when you see ticks on your dog's fur or skin, they are basically parasites. They are, the dog is caught on the ticks, while walking in the park, and these ticks, they suck blood and obviously are termed as parasites. So they are riding on another animal, and they are getting their food, from that organism. They're living off that organism, which is the dog, and that is why they will be termed as parasites. Now, when we talk about bacteria, virus, and different types of parasite, we'll go into a bit more definition just to look at this right now to put it into perspective. So when we talk about, say, bacteria, what is a bacteria? A bacteria is basically a microorganism. And when I say it's a microorganism, it is basically, a unicellular organization. Bacteria are the simplest form of, say, for example, organisms that we find, and they are unicellular. That means they are one cell, or they are one cell organisms. Now, a large number of infections in humans are caused by bacteria, and there are many types of bacteria. So when you see, and we use the terms Bacillus, Spirillea, Vibrio, Coccus, these are different genera or types of bacterium, and there are different types of diseases which humans can contract, and they would be termed as diseases which are caused by bacteria. Then there are viruses. Viruses are also unicellular organisms. They are smaller than bacteria, and they can cause infections in multiple types of organisms, and they cause infections by multiplying. So when you catch a cold, your cold, or on the first day is I would say, you just have a bit of a running nose, but in the second or the third day, you have the aggravated symptoms of a running nose, and you're probably going through a tissue box maybe in an hour's time or 2 hours time. And this is where, when the virus starts multiplying, the infection starts to increase, and you see increased symptoms of the infection, which is now being shown on your body. So viruses can survive within the human body. They do not live long, and sometimes when we get medication, antibiotics, or medication that we normally have for a particular symptom, then they will overcome the virus reactions and will help the body recover. And then we have fungi. Now, fungi are also types of unicellular organisms, and they typically appear as molds and yeast. Now, have you seen molds somewhere in your daily life? When you say, for example, are in the kitchen, do you see molds anywhere, or any sort of food that can develop mold? So anything which can get stale over a period of time, has an expiry date in terms of food, you generally see molds and fungi, or some sort of a green growth happening on the food. We typically get to see this in breads. I don't know how many of you realize, but if you have a bread and it's gone beyond a particular date, you'd normally see some green marks coming up in certain places, and that is the growth of fungi, or organisms like fungi, which basically start to appear. And they then, if they are, if you have something which is infected with fungi, then in those cases you would generally see that you would also have an infection or a reaction in your body, and they would be generally caused by fungi. Now, fungi can affect skins. They are typically organisms which grow on your body, on your skin. They normally do not, they are normally not found within the human body. They will have growth, or they will show symptoms which are appearing on the skin or on the surface of an organism. And they typically tend to cause what are called skin-related reactions. So you might have a rash, you might develop, say, for example, some sort of a blister, and they would be, caused by organisms like fungi. Now, it is important for you to understand this at the beginning, is because when we will go into a bit more detail about talking infections, these infections are primarily going to be caused by different types of organisms. So organisms which live off the skin or on the skin of a particular animal, or they would be type of microorganisms which can be ingested or can go into your body and cause different types of reactions. Now, when we talk about infectious diseases, why we say infectious, the word infection and infectious, the infectious part of it is that when we talk about infectious, that means it can affect somebody. That means this particular type of condition or a disease or a symptom or sickness is liable to be transmitted to other people. The transmission of this disease or this infection can happen through same type of organisms, can happen through animals, can happen through different types. And in some cases, when we look at, I don't know how many of you recall, but when we had the news outbreak of the COVID-19 virus, this particular pandemic, which obviously spread initially from China, what you would generally see is that they said that the virus jumped from bats to human. So transmission of diseases can happen amongst animals from one to different type of animals. And when we talk about infectious diseases, we are talking about spread of these conditions, which is sickness, some sort of, when I say sickness or some sort of an illness, and this is happening between different organisms, and they could be because of bacteria, virus, fungi, or parasites, and they would be termed as infectious diseases. Now, sometimes you would see during the COVID pandemic, we had this particular campaign of 2-meter social distancing, washing of your hands, is because personal hygiene had to be maintained by washing your hands, because if you wash your hands with for about 20 seconds, with soap, then it had the ability to be able to control the virus if it was if you touched a surface which was infected with COVID-19 virus, then the soapy water or solution could actually do away with reducing that infection or doing away with that infection. And that is why it was recommended that you need to wash your hands with either soapy water for 20 seconds or use a disinfectant like a hand gel. And this is what we saw during the COVID pandemic, that everybody carried a hand gel, everybody wore a mask, and everybody maintained a social distancing of 2 meters initially. And this was to stop the spread of the virus. So when we talk about infectious diseases, they can spread from one human to the other. They can spread amongst animals, from animals to humans, and they can also be spread across by things like touching, kissing, coughing, sneezing. So when you sneeze, obviously we don't see it with our open eyes, but Japanese scientists conducted experiment that how COVID-19 virus is actually spreading through sneezing, and that is why the face masks were mandated to be worn in public areas, is because when you sneeze and cough, you incidentally blow out microorganisms or say microgranules of saliva and your cough into the air, and this, when contracted by a healthy individual, can lead to the infection and contracting of the COVID-19 virus. So there are lots of different types of infectious diseases. A few of them that we've heard of are things like, everybody's had chicken pox when we were growing up. They are diseases for which we get medication once and our body becomes immune and it produces antibodies. And that means you would not have this again. Measles, chicken pox, are bits of diseases that everybody would have had during their childhood. And if you have not had, then generally somebody who has this condition, then the person who has not had this is kept away so that they do not contract this disease, because your body does not have antibodies or, white blood cells, which basically can fight this particular virus. Now, infectious diseases can be caused, as I mentioned, because of viruses, bacterium, parasites, or fungi. So depending on the type of disease, which a particular type of organism causes, there is a naming which has been terminology which has been put by World Health Organization and various other organizations, and they generally tend to follow a particular naming pattern. Now, examples of infectious diseases would include hepatitis A, B, C. You look at COVID-19 virus, you look at flu, you look at measles, and I've also put in a bacterial virus in particular, or bacterial disease in particular, which is called the meningococcal disease. Now, There are loads of them, and if some of you are interested in looking at finding about a bit more on different types of diseases, then if you go into the references, there is a particular reference that I put in, and this is talking about A to Z type of different infectious diseases that have been listed and recognized, which are known causes of which can be caused by bacterium, viruses, fungi or parasites, and they are listed in this particular on this particular website. So if you look for the infectious diseases term, you will be able to get through to this to get a further reading and knowledge for those of you who are interested. Now, there is a key difference that we also want to understand, which is between understanding what is a contagious infectious disease and what is an infectious disease. So when do we say that the infection has become contagious? Now, if I look at the meaning of the word contagious, just to look at putting it into perspective, the meaning of the word contagious is that it spreads from one person to the other, one organism to the other, typically because of direct contact. So what do we mean when we say that the infection, you are infected, and sometimes when we say this infection is contagious? Now, what we mean by the word contagious is that this infection can be transmitted from one organism to the other, from one animal to the other, and that is why we say this is a contagious disease. Now, COVID-19 virus was contagious. That means the spread of the virus, the infection spread very quickly from one person to the other. And this was primarily because the infection and the virus was contagious. So when we talk about infectious diseases, they are caused by microorganisms. But when we talk about contagious diseases, things like flu, colds, strep throat, or if you have COVID-19, then these can spread in a number of ways from one person to the other. And that is why they are called contagious diseases. So there were lots of measures put into place, and I don't know whether you remember the COVID-19 measures, that were put into place in the UK and around the world, and some of them were quite synonymous with images, which meant that that you need to look at, for example, if you were in a closed location, look at, for example, this is one of the messages which was introduced by the government, which says hand, face, space. That means you need to wash your hands for 20 seconds, cover your mask, cover your face with a mask when you're in a public place, and maintain a minimum social distancing of 2 meters. And if you're in closed spaces which have obviously a lot of people inside, then the idea was to keep your windows open or the doors open in order to have proper circulation of fresh air and reduce the risk of infection or contagious spread of this particular disease. And that is where we will talk about or use this terminology, which will say that the disease is contagious. Now, there are certain diseases which we also look at are contagious, and they could be, certain type of diseases that we talk about. And these type of diseases typically tend to be, say, for example, apart from talking about cold and flu and, COVID, there are sexually transmitted diseases, STDs as we call them, and these type of diseases can happen because of bodily contact. Now, they are also called contagious diseases. Now, sometimes we talk about these contagious diseases because in particular, there are no medications or treatments available for them, and prevention and precaution is the only way to avoid contracting these diseases. So sometimes when we do talk about certain types of diseases in particular, there the focus is predominantly by the government and the Public Health England, which basically is a body, PHE, which runs campaigns that we see on television, hoardings, on posters and leaflets and other bits, that they try and spread enough information about so that the members of public population are aware of that these conditions can be fatal, these diseases can be contagious, and in order to avoid infection, you have to use necessary protection, and prevention is the best cure in these cases. So, for example, when we look at cancers, although cancers are not contagious, but in some cases, when we look at diseases which are predominantly measles, chickenpox, smallpox, we look at polio, we look at certain diseases which are classified as STDs or sexually transmitted diseases. In these cases, prevention is mandated. Precaution, sorry, is mandated, because precaution helps control the spread of these diseases from one human to the other. Now, with this understanding in mind of the broader sense of what is infection, what is infectious diseases, what is contagious disease, and some examples in terms of understanding how these are caused using, from microorganisms like bacteria, fungi, parasites, and viruses, we would now get into discussing some of the assessment criteria, and then dwell into a bit more detail with regards to discussing what is infection, how does it spread, how do we prevent spread of infectious diseases, and then we look at two scenarios in which we talk about a care home to see how infection outbreak happens and how it can be controlled in a health and social care setting. So any questions on this so far, on what we've discussed? Any questions? Right. So from our aspect, what we want to be able to do now is primarily get into some of the assessment criteria, and then look at these assessment criteria in terms of, discussing, related to how do we reduce infection, and how do we look at, essentially controlling the spread of infection. So when we look at the first assessment criteria, it talks about explain the cause and spread of infection. So when we look at what is infection, we've discussed that it is a microscopic organism which could be either bacteria, virus, parasite, protozoa, any sort of fungi, which basically causes some sort of a reaction like a sickness or an illness on your body, and that reaction that you have is termed as sickness, or the symptoms of a disease. Now, these microscopic organisms basically spread the infection, and they then, when the infection spreads, your body shows some sort of a reaction, which is either coughing, sneezing, fever, rashes, whatever, symptoms that we see. And if they are not normal symptoms, or they are not, symptoms that you generally have maybe during the course of the year because of change of weather or because of the change of climate, then they would be termed as diseases. Now, if I have kids and they are, entering puberty and they have pimples which are appearing on their skin, now that is not a disease. That is not an infection. Pimples obviously are a part of your growing process. Your body is, undergoing a hormonal change, and obviously teenagers would typically develop pimples. So these are not going to be termed as infections or diseases. Yes, in certain cases, when we look at cirrhosis, or when we look at certain types of, spotting or pimpulation, which typically happens on the skin, that can be, contagious. So generally speaking, what we tend to do is acne, for example, is not contagious, but it could be genetic. It could be something which which teenagers could develop, but that would be not termed as a disease. Now, if we have cirrhosis, which is, your skin becoming porous and, cracking up, and it then spreads to the other parts of the body in a particular person, then that would be termed as an infection. And that is generally caused by the growth of some sort of microorganisms, or maybe some sort of a infection that your body or your skin has caught, and they would be termed as infection. Now, when we look at different types, we've discussed this in a bit more detail already, but I've put some, paragraphs here so that when you look at doing your assignment, you have enough, material to be able to look at how infections are caused. Now, when we look at how do infections spread, which is the main task that we are looking at. Now, there are 6 stages through which your body will show some sort of a reaction, and this is what will be termed as what is called spread of infection. So a spread of infection would typically happen through when you catch one of the pathogen, or one of the type of microorganism, which could be bacteria, fungi, virus, some sort of a protozoa, or some sort of a virus or some sort of an organism which is going to make your body function differ from what it normally does, and it starts showing some sort of symptoms, in your case, of fever, cough and cold, sneezing, whatever it is. Now, when your body gets infected, you would then also feel differences in terms of how you're feeling. So for example, in some cases, some patients feel a bit weak. They develop symptoms wherein they start to feel weak, they can have a headache, and these are ways through which infection, when it is spreading, is manifesting or showing the outcomes on your body. So in some cases, that the infection spreads, as we use the word, or travels across in your immune system, you would see different types of reactions or different types of symptoms which your body begins to show. Sometimes you have a case of a bad cold, but over a point in time, because you're sneezing too much, you're obviously having a dripping nose, you would generally see that in addition to this, if it's extremely cold, your nose becomes red, or you develop symptoms wherein you start to feel that you're feeling a bit weak, or you're feeling a bit dizzy, because your body is continuously trying to fight that pathogen, and all the resources of your body are being channelized on that side to be able to reduce the effect which this pathogen is causing on your body. So infections can spread through people, they can spread through pathogens, or these type of organisms which basically can cause some sort of a reaction like illness or a sickness on your body. They can go from one organism to the other. They can be transported between maybe your pet dog or cat to you. And in some cases, you would also see that sometimes these pathogens also look at a way out. Sometimes what happens is, if you get a cold, then after a cycle of 1 or 2 days that it goes through, you see your cold is getting better, but somebody else in your family has caught cold. So the virus actually jumps, or the symptoms, your symptoms start to reduce, but somebody else starts to get the same symptoms that you had, and they start to develop cold and flu. So sometimes you would see that this would mean the pathogen is jumping from one organism to the other. So it is leaving the host and it is finding a new host, because you've taken medicine and your body started to now generate antibodies and it's fighting it, and it is not able to survive. So what the pathogen does is jumps to another organism or another person. And in this case, your cold is on the decrease, or your flu is on the decrease, and somebody else starts to pick up those symptoms and will go through the exact same process. And you would generally see that if as a family, if you had COVID, I think if proper isolation procedures were not put in place, everybody in the family had COVID. If you get flu or you get cold and cough, and if your kid comes back from the school and they have cold and cough, you generally see over a point in time, in 2 or 3 days, the entire family or all the members of the family have, cold and cough. And this is because the virus jumps from one, organism to the other. As the other starts to heal, the body starts to heal, develop immunity or antibodies, they will jump to another host to survive. And in this case, the infection would actually spread. Is that clear? Any questions on this so far? So now we will look at discussing the second assessment criteria, which is related to how do we look at preventing infection. How do we control infection? How do we prevent infection? Now, there are lots of ways through which, why the infection control or, prevention is required. Now, if I have to look at it from a point of view of an organization where you work, I think some of the key bits would be that the organization needs to look at, or if a care home, if we look at, or, we look at a hospital, look at a surgery, or, any department, you would need to look at preventing infection, because this would basically mean that, one, you're trying to prevent it because you want to prevent a further outbreak. You want to look at, in some cases, when organizations were asked to put COVID procedures in place, they were looking at putting these procedures in place because they were trying to protect their reputation, to say that we are still functional during the pandemic, we are able to continue as normal. And to a certain extent, if this kind of an outbreak happens and a lot of people get affected and a lot of people have fatalities, then it leads to a bit of loss of reputation, saying that the employer has not put enough measures in place, or the organization has not put enough measures in place to control the spread of infection. Now, it can also lead to other people catching the illness, which would mean that they would be taking days off, and that would mean productivity, work would suffer. Now, these are some of the consequences of what we see, why we need to prevent infection, why we need to control the spread of infection, because safeguarding is useful in this case in order to stop the spread, which would allow the organization to function normally. It will maybe help protect its reputation. It will prevent further outbreak, which is happening. It will also look at people not getting ill, or the measures that they put in place would essentially allow other staff and members to work normally and not fall sick because of that spread. And the last but not the least, it also reduces harm for people who are vulnerable. That means if people have underlying conditions like type 2 diabetes, or if they were overweight, or if they had, for example, high cholesterol, or some sort of conditions for which they were already receiving medication, and if they contracted COVID, the chances of they having harm or fatalities or getting into the ICU were higher because of their previous underlying health conditions. And these are important for preventing and spreading and controlling the spread of infection. Now, there are lots of things that we can study in this particular assessment criteria, but the main bit that we want to focus on is, why do we need to prevent and why do we need to control? The reason why we need to do this is because it is essential to ensuring that people are safe within a particular environment. Now, whether it's your employer, whether it's an organization, whether you work in a care home, hospital, everybody is scared for their own life. So obviously, if an outbreak happens and if it spreads quickly, everybody is worried that have they contracted the virus, would they fall ill, what kind of outcome will they have because of that illness and because of that virus. And that is where government has put some legislation in place to ensure that if there is an outbreak which happens, then there are adequate procedures in place to prevent and control the spreading of infection within a particular location. Now, there are various infection prevention programs and institutions and government regulations which provide this. There is a body called inspection, which is called IPC in particular, and they are a body which basically looks at infection prevention and control in the UK and in Europe. And this body typically regulates and brings out legislation which all organizations within the health and social care setting have to follow. And these rules, regulations, and policies are put in place which allow the controlling and preventing of the spread of infection should an outbreak is to happen within a particular location. Now, sometimes when we talk about infection prevention programs and some of these policies and procedures, they are predominantly divided into some areas. There are some key areas that would help, if you implement these, that would help prevent and control the spread of infection. These tend to be surveillance. They tend to be isolation of patients which have contracted the disease. It could be looking at carrying out an investigation to see why the outbreak has happened. Sometimes you see in hospitals, saline solutions and blood transfusions which have to be carried out, blood samples, they get infected. Now, if proper monitoring is done and proper investigation is done, this could help avoid some of these outbreaks in the future, which has led to a lot of fatalities in some of the hospitals and the PCCT trusts or the clinical commissioning groups which are running certain hospitals. I think the last outbreak that we saw and read about in the news was the blood transfusion scandal, which has happened somewhere in down south in the UK, and the victims and a number of patients lost their lives, and a lot of their relatives took the hospital and the authorities to the court, and they won the case after about 30 years of fighting a legal battle. And this is because they felt that proper investigation management was not done in order to control that outbreak. That means the infection of blood, which was given to under blood transfusion given to different patients when they were undergoing treatment or operations during a particular period. Education and training, looking at journal recommendations on how good health hygiene can be maintained within the organization, development of policies and procedures which would be directly related to prevention of and spreading of these diseases. And sometimes you look at, even this is most important, we also look at environmental hygiene, things like proper disposal of clinical waste, syringes, medication, dressings, wound dressing, things like that. So anything that you look at as hospital waste, which is coming out of, dressings and medication and procedures, that has to be disposed of in a safe manner, and that would be covered under what is called environmental hygiene. So when you look at getting into a hospital during the COVID outbreak, wearing PPE, personal protective equipment, sanitizing your hands was absolutely mandatory. In fact, most visits were not allowed, but if you had to visit and it was critical, there were lots of procedures which were put into place by hospitals to ensure that the spread and control of the infection is done. Now, in terms, when we talk about the main important aspect is what legislations have been put in the place or have been put in place with the government to ensure that organizations and places where people receive treatment, they are safe, and it helps implement these policies and procedures, and they basically prevent and help in the control and spread of infection. Now, these are certain basic regulations that have been put in place, and I've put them as a bit of a summary here. So when you look at the Health and Safety Act, basic implementation of this is that an employer, when you work within an organization, has to ensure that the premises that you're working in are safe and clean, and they are, both for the employee and the employer. So one of the legislations in place to help prevent, control and prevent control and prevent the infection of diseases or spread of diseases is having a clean environment, having a cleaner working office, and ensuring that it is, the environment which is provided and the facilities and the equipment which is provided are, something which do not look at spreading any sort of infection or cause any sort of, or put employees in the harm's way as far as, they're working within the premises are concerned. Now, in the UK, we look at public health, control of disease, which is the Act of 1984. We look at the Health and Social Care Act of 2008, revised in 2012, and then in 2014, we look at the Public Health Infectious Diseases Regulation of 1988. There are certain legislations which are within the Food Standards, Food Safety Act, Food Standards Act, Food and Hygiene Regulation. Then we look at personal and protective equipment at work, which has played a very, very vital role during the COVID pandemic. Then we also look at workplace regulations, which were introduced not just for health and safety, but also for welfare of employees. That means generally ensuring that, if you have facilities like toilets or common areas, they are generally kept clean, they are free from any sort of debris, equipment, and they are not going to cause any harm to the people who work within a particular organization. For example, if you're in a closed premises and there are no windows available, for ventilation, then sometimes employers need to, not sometimes, as per this regulation, employers have to install what are called, air purifiers or dehumidifiers, because the only air which is being circulated in those rooms is primarily through air conditioning, and that can become contagious. Now, the repair and upkeep and maintenance of the equipment has to be done on an annual basis or as per the contract which has been specified in the services side, and that helps prevent the spread of these diseases. So for example, if the office is only ventilated through the air conditioner, that means, or air conditioning only, that means air purifiers, dehumidifiers, and air conditioning vents have to be serviced regularly under this particular legislation, which is the Workplace Regulation of 1992. Now, there are a few others that I've listed down here, which is control of hazardous substances, which is called the COSH regulation of 2002. So things like asbestos which are used in false ceilings have been banned because they were known to cause cancer. So these are now substances or materials which cannot be used in construction because they're associated with causing irritation or causing cancerous conditions or help in the spread of some of these diseases, and they have been done away with. There is an environmental regulation, protection regulation, which was introduced and amended in 2003, which is looking at the controlled disposal of waste, which is coming out of hospitals and such setups. That is quite important. We have the hazardous waste regulation. We have the Health and Social Care Act. We have reporting of injuries, of diseases and dangerous occurrences, which is called the RIDOR in short. So, for example, if you have an outbreak of a Staphylococcus bacterium, that means people start to develop diarrhea. And this is because there is a waterborne bacterium which is causing this as a outbreak within an office or a premise, and everybody gets infected. You go to a restaurant and you had some food, and obviously next day you realize that you're not the only one, but there are maybe 200 people who've had food in that location, have developed symptoms and are having symptoms of diarrhea and things like that. Then in this case, the employer, which is the restaurant and the location, has to mandatorily report the infection of such outbreak of such diseases so that regular inspections through food and hygiene department and food and safety standards can be done, and it can be prevented. Further outbreaks can be prevented. Isolation of that premises has to be done, or in some cases, further de-infection of the premises has to be done to ensure that the spread of the disease can be controlled. So one of the ways through which we can prevent and control the infection of diseases is by following government legislation, i.e. regulation, which is developed into policies and procedures and then implemented within a particular setting, which is a health and social care setting, like a care home, hospital department, A&E department, or a surgery or whatever. And that helps in the control of and spreading of the infections. Other things that we look at, which we generally see, which practitioners in this field follow, things like performing hand hygiene, washing your hands, making sure you are using disinfectants, you're using a sanitizer, you're obviously disposing away. If you're sneezing or if you have a condition wherein you've caught a cold, then obviously you do away with these, your tissues and other things safely. There's a regular cleaning of some of these surfaces, which tend to happen because it's a high traffic area, and there are chances of microorganisms infecting these areas. So regular cleaning of these areas have to happen. And sometimes when you have an outbreak happening within the school and things like that, you would generally see that the school would then recommend certain procedures like, okay, you need to take a day off, or you need to be treated, and you are given let's say controlled leave to say, okay, you unless you get proper medication and you get well soon, you are allowed to take days off and things like that. So this is the way through which you would generally see how controlling and spreading of infection can be done. Now, the government in the UK obviously ensures that through the standard infection control precautions, which are called the SICP, and the infection prevention and control measures, IPC, they recommend these measures predominantly to ensure that controlling and spreading of infectious diseases can be done in any particular location. Now, you could read in a bit more detail about this if you are wanting to get more information on the .gov website, and that would give you a detailed idea of how the government actually creates guidelines and looks at preventing diseases and spread of those diseases to happen in public places or in locations wherein you have high traffic areas. So this is a report which has been published and updated on 31st March last year, and it talks about very systematically in terms of how infection can be prevented, what are the risk assessment measures, and how the spread of infection can be done. And I've listed some of these main points there on the slide, but if you need to get details of how hand hygiene prevents infection, then some part of this would be a good read when you look at reading this particular article. Now let's go across to the So any questions on this so far? Any questions that you would want to ask? And this particular article, what I'm going to do is save it as a PDF and then make it available for you on Moodle, because this is specifically related. It's not a general guidance, it's a guidance primarily for health and social care setups, or for health and social care related organizations. Now, the next one talks about explain how to reduce spread of infection. So I have taken material directly from the government website in terms of guidance, and there are lots of ways through which you can reduce the spread of infection, and I've listed them out in a few slides. So hand hygiene during COVID, we are all aware that we were asked to look at washing hands using disinfectants and gels to be able to make sure that there is no spread of infection primarily through our hands and through our body, especially because when you go to a particular location in a public place, you open the door, you use your hands, you basically are could be potentially spreading the virus that way. Now, the second one that we talk about is personal protective equipment. When we talk about personal protective equipment, use of gloves, gowns, these kind of things, which basically are color coded and they are used by different practitioners within the health and social care setting. They help in preventing the spread of infection, and they are one of the routes that would be required mandatorily to be used by doctors, nurses, healthcare assistant workers, people who work and provide and directly work with patients within a particular area in a hospital, in a department, would be required to use PPE as a means to prevent the spread of infection. Cleaning the environment, cleaning spillages. We talk about cleaning bodily fluids, and then obviously disposal of this, bandages, the wounds which have been dressed using, bandages, or when we look at linen, which has been used by a patient, and obviously you see bed sheets and bed covers and all the bits, they get changed after a patient has been seen by the doctor or has been discharged from the ward. You would generally see all this is changed because they go through a particular maintenance routine wherein these will, some of them would be done away with, and some of them would be washed. If there are blood stains and things like that which have happened, then obviously they are done away with. But in most cases, you would see that they will go through a process of washing, cleaning, and that would then make it reusable in some cases to be given to new patients or put into the use in wards. But generally speaking, some part of this equipment is normally done away with, and that is to keep the spread of infection and control the spread of infection. And that is where some of these procedures are put in place. So disposal of syringes, disposal of anything which has been used to treat patients is done in a way wherein that is termed as clinical waste, and it is done in a way wherein it is safe and it is away from harm's way in terms of spreading any further form of infection. So this bit is also in that article which I have shown you on the .gov website. And if you read through that article, which is a 10-12 minute read, you would get the details. And I've kind of summarized that on the slides here. So a simple task here, but just to look at this particular task, you're talking about ways in which how you can help reduce the spread of infection. Now, going across to the merit criteria here, we need to talk about how an outbreak of infection can be managed within a health and social care setting. So for this, I have taken a bit of a scenario of a care home, and we will talk about and discuss the COVID-19 outbreak, which typically happened, and a lot of patients lost their lives. Specifically, the death rate in the care homes were higher than some of the other countries, is because of the shortage of PPE, personal protective equipment, and some of the conditions that people who were over the age of 65 had underlying conditions, and obviously the proper spreading and controlling of the infection and measures which were required to be put in place did not happen on time, and that is where it led to a lot of fatalities in the UK in particular. So a lot of people who were residents of care homes actually ended up losing their life. So the scenario that we would talk about, because we need to talk about an outbreak of infection, we look at understanding what is an outbreak, how it is managed, but we are going to look at focusing on what is an outbreak first. Outbreak in a location which is a health and social care setting, but in specific an example of a care home, and what is the infection or the outbreak is. The outbreak and the infection that we're going to talk about is COVID-19. virus. Now, also, let's look at understanding what is classed as an outbreak. What would you say is an outbreak? An outbreak is the same infection affects more than 2 or more people. That means if I contracted COVID and I was working in a care home as a doctor or as a nurse, then 2 or more of my colleagues, if they contracted that from me, then that would be termed as an outbreak. So if you have the same set of symptoms and you have the same set of symptoms being shown because you are working in a similar location or you're living together in a same location under one roof, then that would be termed as an outbreak. Now, when we talk about outbreak and when we talk about, how it needs to be controlled and prevented, sometimes you would see that all organizations within this sector would need to have mandatory trained staff in terms of preventing and managing outbreaks. So there are trainings which are put in place, and these trainings are mandatorily required to be done by all members of staff which are working within this location as per government legislation. Now, when an outbreak happens, you would generally see that, where we start to put certain procedures in place, things like isolation, things like cordoning off the area, or restriction in terms of people, or people having access to those premises, and in terms of trying to quickly treat and understand what are the symptoms which the patients are facing, so that proper diagnosis could be done, and then some sort of a treatment or some sort of treatment measures could be put in place to help patients get rid of that infection or come out of that particular condition. Now, when we talk about care rooms and we talk about how outbreaks are managed, there is a process which the government has mandated, and that process in terms of how an infection or an outbreak is managed within a careful set, health and social care setting like a care home, tends to be called the ppdm. That means you need to prevent, you need to be prepared, you need to detect, and you need to manage. And that is how an outbreak in a care home or any sort of a health and social care setting is managed or is brought under control. And this process that is used and all staff is essentially trained on this particular process is called the ppdm: prevent, prepare, detect, and manage. And what I've done in the subsequent slides are basically talked about what do you mean by prepare. That means using the SICP guidelines, which is basically the guidelines provided by the infection and prevention control organization, and the procedures which the government has put in place, things like how standard infections can be controlled and what precautions can be taken, would be used to prevent the outbreak of this virus or this outbreak of COVID-19 in a care home. Now, some of the precautions which can be taken is obviously looking at going back to the government guidance of frequently hand washing, making sure you're wearing protective equipment. You're also then, promoting personal hygiene against, usage of, say, for example, protective equipment. And then in order to assess, to ensure that there is no further, spread which is happening, you proactively basically go ahead and start, assessing new residents in a care home to say and test, which means that you start conducting certain tests to check whether they have contracted or not contracted the virus. So rather than being reactive, you become proactive and you start this process of assessment to see whether the infection has started to spread. And if they've started to spread, then you start looking at isolation and cordoning off of certain areas, so that in this case it prevents the further spread of infection within the care home. Now, in preparedness comes from training and development. So obviously, if you're new and you're working as a new member of staff within a care home, or you're already an experienced member of staff working in the care home, a lot of us did not face any pandemic or weren't aware of COVID-19 as a virus. So this was a brand new disease or a brand new virus which has manifested, and obviously we weren't prepared for it. So in this case, as the details started to surface, there were training and development programs put into place, and there were basic precautionary measures put into place, things like hand hygiene, personal hygiene, the use of personal and protective equipment in order to stop the spread of the virus within care homes, because there was no vaccine at that point in time when the pandemic broke out, and obviously there were no proper medications available. So in this case, a lot of people typically were trained essentially to start to observe basic guidelines of how infections can be controlled and how do we reduce the spread of these infections within care home. Now, we also talk about detection. So once you're trying to prevent, you're prepared, then you try and detect further spread of infections or further spread of this outbreak into other members or, people within the care home, which could be family, friends, relatives, staff, say, for example, partner suppliers who are providing these services. So the idea here would be to detect that. That is where you would see the COVID tests were introduced. You had the initial COVID test, which was introduced, and later on we had the different types of COVID tests, which primarily gives instant results. So the government, over a point in time, started to make available what are called the COVID test kits, and they were, if I don't know if how many of you recall, but detection was typically done through, first initially you were asked to go into COVID test centers, and then obviously you had to take do a nose swipe and a tongue, your throat swab, and then the results were made available to you in 2 or 3 days. But as with time, the say the information and let's say knowledge about how the virus could be tested spread, and it was then obviously through experimentation confirmed, the government then started to make available what are called the lateral test flow kits. And these test kits, the lateral test flow kits, basically give you the result of detecting the COVID infection or virus in about between 10 to 30 minutes. So you could take a rapid lateral flow test, and you had the kit which could be dispatched to your home, or you could use, one of your colleagues could basically ask you to use that kit to detect whether you are infected or not. So detection at some stage became very important, and government started to make available kits so that you could actually proactively ask the residents of the care home to start taking tests, and if they detect tested positive, then they were put into isolation procedures, and they were put into the same procedure which was essentially required to treat COVID patients. And before this, we also had what are called PCR tests. I don't know how many of you recall, but the PCR test were also introduced by the government. So they were the ones which primarily looked at testing. Initially, when they came out, it took 5 days for your result to come out, and they were the PCR tests. Later on, as more information was available, the government were able to, and the companies and pharmaceutical companies and medical organizations working in this sector were essentially able to develop what are called lateral flow tests, and they were able to detect the symptoms of you being infected by the COVID-19 virus in about 10 minutes to about half an hour. So detection is quite important to help in the prevention of the outbreak of any such virus or condition in a particular place like a care home. And the last bit was management of the whole system in terms of spread and prevention of the spread of COVID-19 within a care home. So as it was detected, it was important that management people who are in the leadership and management position were able to show leadership to take bold decisions to ensure that the outbreak can be controlled, and in certain cases put stringent measures in place and actions in place which were supposed to be recognized and which was supposed to be adhered by all members of staff within the care home, and they were done primarily to control the outbreak. So, for example, a complete ban on and suspending the visitors or people to be able to have visitors come to the care home to visit their elderly. So visits were totally stopped. Transfer of patients from hospital to care home to hospitals was totally stopped. The use of protective equipment was made mandatory. Disinfectants, different types, in different settings were introduced, and they became mandatory to be used by the staff and the staff which was providing these services to patients. And then allocation of staff to specific areas within the care home was done, so that even when the staff movement, when staff movements were controlled, you could prevent the spread of infection happening between different departments within the care homes or different locations within the care home. And regular procedures were carried out to decontaminate. Cleanliness procedures, decontamination procedures were carried out on a routine basis to ensure that the spread of infection could be controlled. That means no other residents within the care home could or should get infected, and all these procedures were put into place because of the management decisions or guidelines issued by the government, and then the management of a particular care home putting these guidelines to work within the setup that they were managing. And this allowed, the number of deaths or infection deaths due to the infection of COVID-19 virus to be controlled or brought under control. So here in this task, which is basically talking about an analysis of an outbreak, what we need to be able to do is talk about a care home or a setting in the health and social care, specifically with an example, hospital, clinic, community center, surgery, pharmacy, or a care home. And then you have to use the ppdm process, which is basically looking at prevention, preparedness, detection, and management of the process to be able to control the outbreak of an infection within a particular setting that we are talking about, which is care home. Now, any questions on this so far? Any questions? Okay. Now, what I would want to also quickly and briefly discuss would be the aspect of, how do we look at risk assessment, which is important as a process in controlling the spread of infectious diseases in a particular health and social care setting. So let's look at very briefly, what is risk first? Why do we need to do risk assessment? So risk is basically, defined. If I look at, basically looking at defining the word risk, what is the meaning of the word risk? The meaning of the word risk is basically looking at a situation which can, lead to you being exposed to some sort of a danger. So in this case, we are looking at the spread of infectious diseases. Now, when we talk about risk and risk assessment, there are certain procedures which have to be put into place to ensure that infectious diseases cannot spread. And this is what we will need to cover with an example within this particular task. We are going to be looking at assessing risk, which can contribute to reducing the spread of infection in a health and social care setting. Now, when we talk about how does the infection spread, so we need to look at the reasons first, because it is talking about assessment. So you need to be able to explain the task first. Now, when we look at possible or potential risk of infection, it could be to a group of people, it could be for carers, it could be for people who are working and dealing and providing administration services, things like disposal of waste, handling laundry. They are basically responsible for cleaning within a health and social care home. And these are the set of people which can be at potential risk of contracting the disease. So sticking to the environment or the scenario of a care home, first we need to identify who are the people who are potentially at risk. So these people who are potentially at risk could be people who are carers, handlers, people in the administration looking at back-end jobs like laundry, cleaning, things like that. How do we look at their risk in terms of they contracting the infection or the virus, which is COVID-19? Because if they are handling material or let's say equipment which has been used by a person which is infected by the COVID-19 virus, and if proper precautions are not taken in terms of de-infecting or cleaning the equipment or maybe the equipment which has been used, then in those cases you would see that they could also get infected, and that is meaning that they are at the potential risk of contracting the virus. Now, what is infection control and how risk assessment can be done? According to government legislation and regulation, every organization needs to be able to carry out risk assessment, and this risk assessment as a procedure is normally done at regular intervals. Now, it can be defined as being done in every quarterly, every 6 months, every yearly, but there are risk management procedures which are put in place, and these risk management procedures have to be implemented by the organization to ensure safety, health and safety of employees, the staff which is working, the people who are visiting, maybe family members, the visitors, and in general, the wider public. Now, when we look at these risk assessment measures for a care home, we are looking at starting with, if you visualize and put your thinking hat on, that, okay, who are the people who visit care homes? So, for example, one of the first things which comes to my mind is family members of people who are residents of care home. They are visitors to the care home who regularly visit and visit the member of their family at the care home. Now, they could be at risk to an infection. So how do we look at controlling the risk with them in particular? When they visit, we make sure that they are following a certain procedure, like they are looking at personal hygiene, they are looking at using a disinfectant, they have a face mask or a covering, which allows them to make sure that they are not able to contract the disease. In some cases, if we also ask them, and I think the government guidance during that period was that if you were showing symptoms of, fever or rashes or cold and cough, then you were required to go into isolation for 7 days or 10 days, because COVID as a virus, and before it showed its full symptoms, the virus it had a gestation period of 7 to 10 days. So that is why isolation for 14 days was initially introduced by the government. And then after that, it was reduced to 10 days, then to 7 days. And that was to ensure that if you were contracting that virus and you were showing certain symptoms, then you were, one, asked to stay away from a public place, do self-isolation in your house, and ensure that nobody else comes in contact with you. And these were ways through which risk assessment was done in a personal, on a personal case or on a personal basis. Now, when we talk about controlling and doing risk assessment, we are looking at putting together some tasks and activities which are going to be carried out to reduce this risk of contracting the disease. And they would tend to be the process and policy which is followed by the staff within a setup like a care home, and they implement that policy to ensure that they are carrying out those activities, and those activities, when carried out and completed, negate the risk of them contracting the infection. So here, I would suggest that if you read a particular article that I'm going to make available, which is on a scenario of the COVID, pandemic or the coronavirus pandemic, and then in the context of reading that article from a point of view of, care home, is what I would suggest that you need to look at summarizing, here. So this particular link which I put in is a link, and I'm going to show this to you on the Sky website, which basically would give you, the details of how do we look at risk assessment and controlling the spread of an infection within a health and social care setting. And I am taking a specific example of a care home, because we need, when it says health and social care setting, that means you need to take an organization within this context. It could be a care home, it could be a surgery, hospital, any sort of a setup, but it can't be generically done that health and social care setting. It has to be a particular setup. So this particular article talks about the importance of infection prevention in care homes. And this particular article, which is a 10-minute read that you could read by downloading it as well, to see how and what guidance was essentially created for managers and management within the care home for them to follow, and then look at the process of prevention. So here, for those of you who are looking at, essentially attempting the merit and distinction task, you will need to go about reading this article and then use a scenario, which is a setting like a care home I've done, and then go about completing this particular task. And that would help you understand how prevention can be done on in terms of reducing the risk of spread of infection within, in my case, the example of a care home. Now, any questions on today's discussion? Any discussion, any questions that you have? So there is a bit of additional reading that I put in towards the end, and I would suggest that if you go through those handouts and one or two websites in particular, that would help you understand this particular learning outcome in a bit more detail. And should you think of any questions, or if you have any queries, feel free to email that to me, and I will come back to you with some additional information. But at this stage, what I would like to do is obviously end today's session and then catch up with you next week to discuss learning outcome 4. Thank you so much for attending, and take care.